I want to thank everyone for joining me today. This is going to be an HME provider's presentation of Smart Health One-on-One. For those of you that have joined, I have muted you, so don't be alarmed if you're unable to speak and us hear you. The purpose of this presentation is to discuss Smart Health's One-on-One's platform and what it's doing for the technology for remote patient monitoring. I'm going to go ahead and begin, and I appreciate everyone that has joined us today. This slide deck will be available to be emailed to you, and also we'll have some reference videos that you can review these slides, and also the videos that we have put together for Smart Health One-on-One. So thank you very much. With that, I'll go ahead and begin the slides. We do have the chat feature available there, so if you do run into some type of lag, if you don't mind just hitting the chat, letting me know if the slides are not properly showing for you. But you should be able to see currently it says Smart Health One-on-One. Please wait for your presentation to begin that I'm sharing with you. Everyone should have received a screen sharing link that launches Ring Central onto your PC. If you have not, take the next few minutes to go ahead and download that. I'll go ahead and begin and once you actually download the link, it will show it to you visible my screen for you. So I'll go ahead and begin now. So one of the things that I want to start with is the big push for remote patient monitoring and what it has done to our industry. So Medicare this year released the new reimbursement codes for remote patient monitoring. And this is a published letter that CMS published for in letting people know that starting this year of January 1st, 2019, there's 3 codes that are going to be incentivized for healthcare providers to receive reimbursements. So this article here was the one that was posted back in 2018 that basically said there's going to be 3 new codes that we're going to allow you to go ahead and receive reimbursement for remote patient monitoring. With that in mind, remote patient monitoring's 3 type of CPT codes that were available was CPT code 99453, which was a $21 reimbursement for patient setup and education. What that means for that CPT code 99453 is a physician can now have a set of remote patient monitoring devices, bring a patient in, educate them on the monitoring devices and explain to them how to use that, and then allow them to take those devices home. With that CPT code 99453, the physician now can receive a reimbursement per patient at a one-time fee of $21 just for educating them and handing them those remote patient monitoring devices, which those are the devices that we offer with our platform, and we'll cover that in a little bit. But I just wanted to focus beginning of our presentation in the reimbursement that the physician now has and can make more money on. The CPT code 99454 is a $69 monthly reimbursement that is for technology that the healthcare can now receive for receiving notifications based on vital signs that are outside of the threshold, maybe something that's too high for a patient, too low, that they now receive a $69 monthly reimbursement, and it's reoccurring monthly. So that's every month they can receive that $69 per patient per month for having technology that is capturing data from a patient and is also interacting with some type of threshold values that the patient has been assigned and have someone alert within their alpha staff. So that $69 is what they can receive for CPT code 99454. The final CPT code that they added was CPT code 99457, and that's a $58 monthly reimbursement. What that does, it goes out and allows for clinician staff to carry on at least 20 minutes of a session time per month monitoring patient data. And it doesn't have to be face-to-face. Again, this is all remote patient monitoring we're discussing, where the patient's in the home, the office staff is at their office location, and it can be reviewing the patient data, reviewing triggered alerts that the software has triggered, and the system itself has, we built Smart Health One-on-One to capture those session times. And I'll go in a little bit more in detail of the platform, but I just wanted to go over again the code that's there. So they now receive that $58 monthly reimbursement for at least carrying on 20 minutes of a session time of reviewing patient data. So what does that do for that physician? We talked about those three codes that are available there. One of the things that the average Medicare patient cost for 2017 was $10,739 of healthcare expenses paid out by Medicare, and the patient average cost out of pocket was $7,920. To keep a person alive, every person that's 65 years and older paid out $18,659 during the year of 2017. Medicare now, with those CPT codes, are reimbursing those physicians of $1,524 per year to monitor those patients from home. And that's those three codes I discussed. It comes out to be $1,524 per year. The average medical practice caters to about 2,000 patients, and if 250 of them would qualify for remote patient monitoring, meaning they're on Medicare, 65 years and older, with 2 chronic conditions, without adding the office workload, the expected income per physician's office should be $127 income per month, as we discussed. You times that, times 250 patients, times 12 months in the year, and we'd also deduct $360 for the equipment cost, which is our devices that we supply for remote patient monitoring. That will equal out to be $291,000 per year that they can receive. If we also want to reduce the office staff that's involved, we can take a deduction of $32,000 for that office staff. That would still give them a gross profit of $259,000 gross profit that the physician now has access because of these changes that have done in 2019 for those CPT codes. HME, as those that have been involved with us, have been developing home monitoring since the year 2000. And we actually launched back in March 2003 and tracker. And the tracker that we originally came out with, and this is before Bluetooth, wireless, all the technology, bells and whistles we have now. We started with a POTS line that actually connected to your phone line, and that tracker would have to be connected, the devices, through a cable to that individual tracker, and it uploaded that data from the phone lines. So that technology HME has always believed in, and unfortunately just the industry is just now starting to catch up with that. But I just kind of wanted to explain to you the research and development that has been put together since 2000, and our experience in the remote patient monitoring and technology itself for RPM has been there, for years. And we're very excited that the opportunities now that Medicare and the insurance companies are jumping aboard of moving forward with giving these reimbursements back. So to recap to you a little bit about the CPT codes that we discussed, that CPT code 99453 is, again, for the initial setup and patient education of use of the equipment. The physician can actually store that equipment there in their office, and it gives them that $21 reimbursement. That CPT code 99454 is the other reimbursement for the remote monitoring, and that's the technology being in there, and us being able to capture that data, be able to schedule alert notifications for that individual if their threshold is out of range, that's what our platform does. And then the last CPT code was that 99457, which is the 20 minutes of session time spent on remote patient monitoring. And our software collects that and makes it easy for the individual physician and office staff to be able to see the 20 minutes that that individual has actually spent on the patient itself. One of the big changes besides these three codes that CMS did is before these codes, you had to have a physician, be involved with doing the remote patient monitoring sessions. Now it's any clinical staff member for him, so he can take any person of their team in their office staff, assign him to an individual patients, and review the patient's charts, the patient's monitoring alerts that they've received, and that alone right there. So that's why we said it can be someone that is any clinical staff. It doesn't have to be an MA. That opened the door more for the actual physician and the clinicians to be able to tag under an individual that's going to pioneer remote patient monitoring, and then they work directly with them. And before it had to be the actual physician itself. So what caused the big changes, from the current codes that were out there? One of the main things is 33% less time is required now. The old code that was before 2019 was CPT code 99091. It required at least 30 minutes, per 30-day period. Now we're looking at 20 minutes per the calendar month. There was also a separate payment for the initial setup and patient education. Now they're reimbursed easily by that CPT code, as before it was just bundled together, and they couldn't actually get anything they didn't feel the reimbursement was coming back for them. And then the big major change is the clinical staff, that now they allow for clinical staff. Before that CPT code 99091 that was out there was focused heavily on a physician in a qualified healthcare, which was that MA that needed to be there. Now we can pick any staff member from them, and that can help with the remote patient monitoring. So those are the big three major changes. And for a clinician, those are huge. Being able to know that they get that setup fee, it's on its own code, being able to have anyone from their staff, and also breaking down as not having to do 30 minutes now is just required for the 20 minutes of session time. And again, it can just be reviewing the charts that can calculate up to those 20-minute session times. So what do we provide for, HME provides for the physician? We have a set of devices that everyone's aware of, from a pulse oximeter, a weight scale, a blood pressure monitor, a thermometer, and a glucose monitor. Everything that we have uploads through an app, through a tablet, and in the near future through a TV set-top box. Everything that is uploaded through our devices go through the app, goes to Smart Health One-on-One Cloud, and then from there, we create global thresholds for that clinician of what he or she considered is high or low per device. Those notifications, if they receive a triggered, if a patient takes a vital that's a little too high outside of the threshold or below the threshold, it can send the notification to the case manager. It can send a notification to the physician himself, or even a family member can also receive those notifications. So that's what our platform does, and that's how it actually meets those CPT codes that are out there. These are just a couple of different the devices that we're also using that are integrating with a pedometer so it can capture the steps. But these are the current ones I just covered too with you. And everything that you've seen here is connected via Bluetooth to an app. And again, that app can be reviewed through a smartphone, a tablet, and very soon a set-top box, which will be connected to your TV. So besides the app transmitting data and for the patient experience, we offer a few key elements for the individual patient. The patient easily downloads the app, which is provided with a username and password through the app stores. It's on Google Play Store. It's on the iOS App Store. They have the option where they can see a home screen and review their latest measurement that they've took. They have an option to look at reports. That is a chart that is collecting the data and the plot points, is putting it for that individual patient. They have their own personalized inbox that the individual patient can communicate back and forth with any care provider that is connected to them. And by I mean any care provider, it could be, maybe the office staff, it can be a case manager, it could be maybe a specialist that they decided to connect them to Smart Health. Everyone that is connected with the patient has direct access to send messages back and forth from a clinician portal to the patient's individual app. And as you see the lower in the middle of the screen, we also offer a telemedicine, a televideo kind of call that the care providers can request as long as they have a PC with a camera, a video call that can be done. The patient experience always has the permission of being able to accept or decline any type of call that is initiated to them. If they do accept it, it's a video face call type of call. They see the doctor sees them, and they also have the ability through the video camera to change the camera output to be able to shoot outwards, so that way the camera of their phone can be directed to position into any part of their bodies. And again, we built this app to make it very easy to use. There's a plus sign on the individual app that all they do is click the plus sign in that app, and they will recognize the device that's been powered on and send a reading directly to the app that is already being monitored by their care providers. And if there is something outside of their threshold has received, those notifications go directly to them. So we built this platform for the patient and also for the care providers. We have a patient dashboard. All the data goes into our Smart Health Cloud. From there, we've created the ability for the care providers to create their own triage of messages, which can be, positive reinforcement messages. It can be, don't reminder messages about adherence to follow the prescribed test rate, and they always have that ability to direct connect to them via the virtual visit option, or being able to just send a message directly from their portal directly to the patient app. So one of the things we talk about that I mentioned here is the set-top box, and that's what the next feature of technologies that we're working on is that set-top box is an expansion of our apps that we have on the Play Store and the App Store. So again, we have the smartphones that can download the data, communicate back and forth. We have the tablets that do the same thing. This set-top box would sit in between a cable box and also your actual TV, all connected via HDMI, and it loops it. So you can actually be watching live TV, and your healthcare team can decide to want to send a message to use. It would, just like this, as an example of it, it will say you have an important message. Would you like to go into your inbox? And that same inbox that you have for your smartphones and your tablets is the same messaging center that the TV experience would go through. But the main difference is we're connected live to that individual patient, meaning the care provider's connected live. They have direct contact to be able to send a message, send a video call request directly to their TV. So we're very excited about launching this this year. And that set-top box, again, is just another interface that will allow us to communicate back and forth. And it also extends the experience of the patient dashboard to a larger screen, which is their home environment. All our devices will be able to, once they're near the set-top box, be able to take a measurement, upload the data, and if there's a notification based on their threshold of the reading that they just took, will send a message notification to their TV live. And again, the care provider has full control of any time being able to communicate with that individual patient. Some of the benefits that it would do also for the care providers, they can set up automated coaching times. They can set up the ability to be able to reach them at any time through the TV. They can set up, training exercise sessions. All this, has expanded, to give them that ability. There'll be a little camera that they can set by their TV that again would be the video call, and again it just extends the experience for the patient experience through a TV set-top box. So one of the things we also looked at for here is what HME has done with the software. And the software is approved already by Medicare and is also HIPAA compliant. We have over 108 million people over the age of 50 who can be part of Smart Health at this time. What is now our product? We negotiated with Jumper Manufacturing out of China to stock our products in their factory so that they can be air freighted to us within a week rather than the traditional 90-day time period that we were doing in the past. Most of the orders we were doing in the past, we had to put in an order, overseas, and it still took 90 days, because of the shipment coming by air, the ability to manufacture those supplies. We put this deal together with Jumper to allow us to constantly have stock in these devices that are key for us, which is the blood pressure, weight scale, pulse oximeter, thermometer, glucose monitor. We already have that, but the Jumper line allows us to financially be able to produce these products instead of waiting 90 days in 10 days. And it's a huge financial burden for HME that is no longer have to wait 90 days. So if we get these large orders, we're very capable of reproducing that inventory in 10 days instead of waiting on a 90-day time span. So one of the things also, besides that now that we covered the product and how it's, the ability that we have it here at a very convenient ways, we still need to look at how we're going to market over to the physicians. There's about 486,000 physicians out there. And one of the daunting tasks is meeting with each physician and applying and really developing that sale with that physician. So there's some things that HME has done that has allowed us to connect the dots a lot simpler than going marketing physician to physician. One of the things is that we're connected with a licensed DME dealer through our market. Each DME dealer serves between 50 to 100 doctors to generate necessary volume to do business with doctors. The larger DME companies who we offer have contracts with equipment and buying groups that offer discounts on their daily purchases, but also support the industry in many different ways. There are two buying groups that service 18,000 DME companies. And these 18,000 licensed DME dealers service about 246,000 physicians. HME has contracted with one of the buying groups, and the other is close to completion that we're targeting. So instead of us going after physician to physician, we're focusing on these buying groups that already have relationship with these DME companies. So one of them we've already completed the contract, and that right there is putting us way steps ahead of being in contact with those physicians. That DME company already has a selling relationship with that company, and again, the last one that we're looking to complete would target us to be on pace with all the physicians that we're wanting to focus on. So the use of our technology, is huge for them, because these DME dealers are always looking for that advantage of being able to continue for that physician to want to buy from them. Us now, working with that DME dealer gives them that ability to provide another source of revenue that is out there for them and educating them. So we're focusing our efforts a lot on these DME dealers to be able to really be able to educate them. And this is just another way to put the foot in the door for them to continue to build that relationship, and now offering them, besides the products that they're referring to them, is another source of revenue that they couldn't do before. So we're very excited about that contract we have with them. So with that in mind, what I want to do is jump into the platform so you can see a little bit of what we've discussed on here. So if you give me a few seconds, I'll go ahead and launch that platform. So this is what I'm logging into now that you guys are seeing is the app Smart Health. And I just wanted to show you briefly how the app, how easy the app it was developed. So you'll see down there Smart Health. Now I'll go ahead and launch it. And in here, it takes me in to my dashboard, as you saw images of it. The bottom of the screen, we made 4 simple options. The home screen, which we're currently on, the plus screen, which is to download data, the 3 horizontal lines, which we call the hamburger menu, is your option screen, and then your mailbox. So the home screen here, you can at any time click any of the icons, and it'll take you to see your last measurement that was taken. You can click on just any of the icons and it'll change. This is blood pressure. This is weight. And as you get the point, is basically it's all interactive by you just choosing the icon. The data can be reviewed for the patient. At the right top corner, you see a little graph. You can click that and you're able to see a representation of the data that's being collected. You'll also see the logbook files of each of the individual readings that have been uploaded by the individual patient. In here, you'll see some readings that are say high, some readings that are saying low. All of them that are high and low give you a thumbs down. And all this is actually reviewed or it's set by global thresholds that we build through our platform. As you see, I have one good one out of it. But, I just wanted to kind of briefly show you that and, how that data is collected, and the individual user, which is the patient, can actually see that data and based on the care providers, the doctors, clinician staff, of what they chose is the proper threshold, will return to them of what is good, what is high, what is low. To take a reading is very simple. Actually, before I do take a reading, I want to show you up also in the top of the screen, there's a little white arrow pointing up. That gives you the ability, or as the patient gives them the ability to send a report via fax or an email to anyone that is connected to them or anyone at all, a third person. So I'm just going to click the mailbox for the email option. And in there, it'll give the patient the ability to send a 90-day report, a monthly report, a weekly report, or a daily report. They also have the option to choose their own date range. So if I wanted to do the last 3 days, I have that option to do that. Once they select the date range, they just hit OK, and then it's going to give them any individuals that have that are connected to them. So these are a few different care providers that I have connected with me. I can choose the default one that it's on, or I can go down to the bottom of the screen and put other email, and then just choose, and key in that email. Once I've selected it, I hit OK. The software now is sending that report, and it will send that report again based on the date range you chose, based on the method you chose, which is via fax or via an email, and then based on who you want to send it to, those that are connected to you, or maybe there's a new doctor that you want them to review this and get connected to Smart Health. You can plug in their email or their fax number and they'll receive that. It's that simple. Downloading data is also very simple for the individual patient. So I'm back to my home screen, and down here you'll see that there's an actual plus sign where that's where the individual patient can actually upload data. So if I hit the plus sign, the individual will say activate your device. If I take any of our device, and it's going to go from a gray screen like that saying activate to suddenly now a screen that says ready to take your reading. And it also will tell you that what device is connected. So if this one is my blood glucose monitor, if it was connected to another one, it would title it what that's connected for. If I take a measurement, see if I can take one here without, there we go. The screen is going to go from ready to take your reading. It gives me a thumbs down that it's low. And I wanted to also show you that it's also going through my device to see, and you see sync completed successfully, that reading has now uploaded, but it went through the series of readings that are stored in the device. So we have some devices that you have that would collect historical data. So our devices upload, as long as the app is connected to the device. But we know there's going to be times maybe that you're not near your phone, and you might want to just take a quick reading from your device. The next time that the app connects to the device, it's going to go out and search for those. And if it did not upload it, it's going to go ahead and send that previous reading that you did a few hours ago without your phone or without your tablet, and it'll send that reading and the current reading that you're testing. So that's why you saw those, and I just kind of wanted to show you. But if you look also at the screen now, in my little mail, I now have a 1. And that is to tell me that there's a new message for me. So the patient can actually go into the mailbox, and they'll see now that they have a new, in their inbox, they have a new message that arrived. It tells them the time, glucose level under hyper notification. If I expand that message, it will then show the notification body of the message. It says your last measurement taken was high, and it's considered to be in the hypertension stage. Ideally, you want your glucose level to be between 81 and 129. Your care team is notified each time your measurement is outside their threshold and may reach out to you. Continue to take your vitals daily through the Smart Health One-on-One app so they can determine the best course of action if any is needed. Having enough data for them to review is key in monitoring your health. So again, this is a canned response that the threshold levels are set for this individual patient. If they've received glucose outside of that threshold, it's going to send that notification. So that notification came directly to the patient, to their inbox. Think about the platforms that we have it connected, the type of connections. We have smartphone, we have tablet, and soon set-top box. So this inbox is going to interpret it the same way for each other method that you're connected with. If you're connected to the TV set-top box, that notification is going to appear on your screen while you're watching the Super Bowl, if you did take that measurement during that time. Adherence, if you're supposed to test 1 time a day, you could receive a test time that says notification, adherence, don't forget to test, you missed your prescribed test rate yesterday, please take your measurement as soon as possible. But I wanted to at least give you that idea of how that app works. I'm now going to jump away from the individual app and show you the clinician portal of what we're doing and how those codes that we discussed about of the CPT codes, how easy it is for the individual clinician to use. So here it is. As soon as I log into the clinician portal, Dr. Smart Health is my actual demo that I'm showing you on. It takes you into an expectation screen. In the expectation screen, it shows you the different expectations that you've created. These are the ones that I have under this set type that the demo account I'm using. To create an expectation, very simple for them. They have a button that says create. And now they have the choice for monitoring rules that they want to create. Is it a vital rule? We have two type of adherence rule, a specific time adherence that says at a specific time of this day, I'm supposed to do glucose at 7 a.m. Everything we've developed, gives them the ability to create their own rule name, the body of the message that's going to the patient, the body of the message that's going to the care provider, which is Dr. Smart Health, and also being able to choose out of all the devices we have, what are you going to evaluate? So for here, I choose glucose. Now I have a specific time. I can say at 7 a.m., I'm going to take glucose, but maybe I want to check it again at 7 p.m. So I can now choose 7 p.m. and the system has a 59-minute buffer zone that between 7 a.m. and 7:59 a.m., my glucose reading should arrive from the population of the patient, or you can select just one individual patient itself. You also have notification of how you want to be notified. Our software will give you an email notification, will provide you a voice notification, which is a pre-recorded message telling you to log into the software, SMS, which uses your cell phone carriers, and then inbox, which is your personalized inbox each user account is set up with. You have the ability to notify me, which is me, the doctor, or notify the reading owner. So you might choose email for the doctor, or an SMS, or all four methods, and you might choose notify the reading owner via inbox, which pops up as a push notification for that individual patient itself. And again, if that reading did arrive at 7:30, it would not send anything. And then it would evaluate again at 7 p.m. interval. If it did not receive that at exactly 8 p.m., it's going to send that notification message with the body of the message that you chose for either the patient, the care provider, or one of the two. It's that simple that we've created these monitoring rules. On vitals, it's basically the same way. As you see, the bodies of the message for the patient, the care provider, choosing the reading type. In here, selecting are you going to, what condition is this going to be? Is it going to be a greater than, a less than, or in range for maybe positive reinforcement message? But I can choose greater than. I can then say 300, and then I can choose the population of my patients or customize it for one individual user. I want to notify me via an email if I receive glucose greater than 300 for this individual patient, and I want to have him receive this as a inbox push notification with whatever body of the message that you did. So the software will evaluate that to you under vitals, under the type of adherence, which is time. Adherence really just looks at times per day. I can say 3 times per day. The software now will evaluate glucose, and did I receive 3 measurements for those individual population of my patients, or customized it for just one individual. It will notify me on the method I chose, and exactly 6 a.m. the following morning, it will send those notifications for the previous day of people that did not take those 3 glucose test times that you required. So besides adherence, besides vitals, we wanted to approach the software of looking for trending patterns. What we did with trending is we created a trending rule. And in here, every one of these what we call monitoring rules or expectations can be developed and can also be set that it's not going to notify anybody. So the way you may want to do that is, in this trending, is you create the message name, the body of those messages of who's going to be alerted with what message, but now you have a pick expectation. So I can go in here and now say, you know what, this glucose level or a hyper notification, I want to know that if that's been triggered 2 times in an hour, in a day, in a week, or in a month, I want to be notified. So you can set up trending notifications that are for maybe extreme cases that of a vital that reading that has came in, that maybe you set up that if it comes in, if a person took a reading that glucose is over 300, you send a notification, take it again in the next 5 minutes, because you have a trending rule that if it's received 2 times in an hour, you're going to be notified. The care provider is going to be notified. So these trending ways, monitoring rules that we created is looking for that special scenario. We also have it that what you can set up is borderline hypertension, borderline hyperglycemia. Maybe things you don't want to be alerted each time it's happening, but maybe you want to be alerted if it's happened 10 times in a particular week, and you can say these individual patients are right there at the threshold, and you can start doing some proactive research on those individuals that are right there at the borderline that could eventually need medication. So again, the software was built to evaluate the vitals based on conditions, prescribed test rate, and also trending patterns. And then we developed also a reminder, which is medication reminders. The individual patient you might have that all are taking a cholesterol pill, and you want to have them take it first thing in the morning. You can set up a reminder for those population of those patients, and it's a push notification that shows up to them if you chose inbox, but you can choose SMS, voice, email, whichever way you want to be reminded. The software will send those reminders. You can also create reminders for you and your office staff via the 4 methods that you have. Log into the software, check remote patient monitoring sessions. So once everything's built for these expectations, everything's stored under my expectations. We know that the clinician will have staff members, and everything that the staff member creates would be stored under expectations set by others. So once all that data is collected for the digital care plan, or the expectations as we call them, for the population of those patients, the care provider has access to be able to simply create a new user, which is a patient. They simply key in all the information, the username, the password of that individual patient. They provide the devices directly to that patient. They bill on that CPT code now that they've done the patient education, showing them how to use the app. And one of the big things about it is all our devices, there's competitors out there that will have some type of RPM software, but you have to enter a serial number. You have to do something to get that thing paired. Our devices automatically pair as soon as you log into the app. You click the plus sign, as I showed you, to upload a reading. The app will sync to your phone. Look at the date and time from your phone, sync it to the device, and assign that serial number directly to the individual patient. So that's all there is. All they have to do is download the app, enter their username, password, hit the plus sign, and those devices are assigned. Once that's assigned to them, the individual care provider, if they do have monitoring rules, will receive notifications when to log into software. But when they do log into software, they can also see the individual data that's been collected for them in a 7-day summary. So in here, you can see it will show me the last test times that I took in the last 7 days, how many of them per device. It will show you my last test result. What was the lowest in the 7 days? What was the highest? The average in the last 7 days? What percent was high? What percent was low? What percent was in the good range? And that high, low, and good is what we saw through the app that shows you thumbs up or thumbs down. And like I mentioned to you, that all that is created through global thresholds that the doctor can assign under a settings section. They have global thresholds. And right here is what we created that they can say thumbs up or thumbs down. It'll tell them what's considered low, what's considered high, and then at that point it will show you the good range. By default, we use ADA recommended values to help those physicians that it automatically, when we create an account for them, it has something for them. But again, here it is where they can actually change it and create those thresholds based on what they want to actually measure. So that's the statistical data is collected for them on the summary. They can expand to see more details at any time. And in here, it will connect them right into the graphical representation of the patient data that they can change from 7-day view to a 1-month view to a 6-month view. They can also be able to view exceptions that shows everyone. And here's the one that I just did earlier today, 11:34 a.m. The glucose was glucose hyper notification is stored at an individual user level. And at the top of the screen here is where we push for that start patient monitoring, because this is what's going to give them the ability to receive that that reimbursement for the $127 per patient. They could pick RPM or CCM mode. They easily click RPM and now starts tracking time spent on this individual user. You'll see here at the bottom of the screen that the time has begun to started collecting that session time. And each time that is collected for that individual user. So we know that there's that one CPT code that requires that 20 minutes. The software here starts tracking all that. And if you look on here on the top of the screen too, they can request that video. If there's a camera connected to the physician's PC, it will launch that camera and it will send that message over right to the individual patient, asking them, telling them that they have a call from Dr. Smart Health, would they like to accept it or decline it. They can stop the patient monitoring mode at any time just by clicking that. Software then collects that time. Let me just hit the refresh screen here so we can see the PM session get updated. And then the PM session mode has added that total for that. You can also see that it shows you the qualified time of what is billable. And I'll cover that in a few minutes here. The individual patient can also go in, the care provider can go in and view those, create a note for that individual patient. So they can hit create a note, they have type, initial setup and training completed. That is what launches that CPT code to be reimbursed. We collect it, and there's a few things that our software does that we have support for each one of these. So we're ready to take on the masses if and be able to help any onboarding physician or any account that is tied into us. We help them by making a welcome call to that individual patient, welcome them to Smart Health. We also make sure that the devices are connected. We know that the physician and the care providers will do the setup and initial training and hand those devices. But 24 to 48 hours later, our support staff also calls them to make sure that they're comfortable with doing it in their home. And then we also do a 3-day adherence call. If we don't see any measurement that has been uploaded, we make an adherence request, and the software to have that patient upload data, because we know the more data that's there for the physician, it only definitely improves our software. So we allow that through the software. By default, every note that's added is a private note, which is shared between their staff and the doctor. But if they chose to put it as a public note, anyone connected with that patient, which it could be a family member, could be a nutritionist, would have access directly to that note. So we built that software to give them that ability. and profiles and devices. We also allow them to be able to upload an image. There's multiple John Smiths. You can have an image that displays all, a picture for the individual user. So once all that data is there, we know that we've also developed a population reviewing that. You can run filters by condition, filter by the expectations you create, and then filters by your global threshold settings. In here, you can choose any particular date range. So we'll just choose May 1st through July 9th. We'll do blood glucose. But you can choose any device you have, and then you can hit submit. The software then, based on the global thresholds the doctor chose, will evaluate all those individuals that are uploading data. It'll tell you how many readings it has found. It tells you what the percent of them are high, what the percent of them is low, what the percent of it is good, and then the average reading, and then it gives you the last reading that individual has taken. So you see the one we did, here. And then basically you can jump in to be able to view any one of those individuals. So if we see this one here is at 81%, I want to jump in and view this profile. If I hit visit profile, the software itself is going to hyperlink directly to this individual user, and it's going to now put the date range that you were in, so you can begin a patient monitoring session. And again, you can review and drill down. You can add notes. You can add, anything at all that I was showing you earlier. You're reviewing it at a population data, but you can then drill down to start those patient monitoring sessions. So we build it to promote that remote patient monitoring mode and being able to get all that. So that's what we've done with some population data. Again, you can do it outside of global thresholds. You can do it at a filter by your expectations, and these are all the expectations that I have. So maybe you can classify maybe some expectations built by some, for one case manager that's a set of population of users. You can also run it by your own conditions, going to blood pressure, choosing the type, and choosing that it's greater than or less than or in between, and then you always have your default global thresholds that you set up. We made it very easy for them to add staff members. They just create a staff, and they can invite them via an email, create them, send them where they can manually key that data in. Once that staff member is created, they can expand it and tailor that staff member to only have access to certain individual patients. They also can choose all the expectations that they created that staff member will have access, so they don't have to build their own expectations, but they can. But we gave them that option to be able to just say, these have been built out. You will be alerted also now that we've created you as a staff member. At any time, we also have the big buckets that you have, which is your PM sessions that show you as these codes become available. It'll have 99454, 99457, 99453 that's available for billing. So we show to the individual care provider when an individual is ready to be billed. As you see, this one here doesn't have any sessions at all, and there's no code that's been assigned to that. We give them a date range to be able to filter, to go back and look at review previous months. Here it is, the start and end date. And the same thing with exceptions. Every exception that's been triggered by all users is stored here, where you can actually filter them and review them. Again, everything is set for the user level, but we also give you that ability to be able to view it by the expectation you create or by a certain individual user. Here's where your filters are done. So with that, I'll go ahead and stop the screen sharing session, but I did want to briefly go over the software and show you what we've done for the remote patient monitoring. I appreciate everybody that joined me today. And as you've seen and what we discussed of the CPT codes and the reimbursement that's out there for them, it's a big profit margin that we allow and set up, that our software is there for them to support the reimbursement. And now what we positioned ourselves also is that ability to be able to give them the devices without having to wait, months for that device if that order comes in, has put us way ahead of schedule of what we're looking to do with the physician groups that are out there. I thank everyone for your time, and I will send an email of the slides that will have references to everything I covered. There will be additional slides that show videos that you can, on your own time, if you want to go and see how do they build these expectations. There's a YouTube video that'll be attached with it that can, you can click and it'll show you that you can actually review at your own time. I appreciate it very much, and enjoy the rest of your week. Thank you for joining me.